I'm Pooja Mehta from Cedars-Sinai, and my mentor is Dr. Noel Berry-Merce. I'm going to present this acupuncture trial that we just completed. And basically what we did is we looked at 151 coronary heart disease patients. We had approximately 30% women and 70% men. So these patients were primarily recruited from cardiac rehab. And what we wanted to do was look at the effect of acupuncture in population that's already optimally medically treated. So we randomized them to traditional acupuncture versus sham acupuncture versus waiting control. They got 3 weeks of treatment for 3 times a week treatment for 12 weeks. And I just want to show you here that the acupuncture points that we used are the ones that our acupuncture team came up with, which are demonstrated here, that have shown effects for altering cardiac autonomic function. The sham points, basically, it's non-acupuncture sites, so they're close to the acupuncture sites, but not in the meridians that stimulate the traditional acupuncture. And it was plastic stimulation. And these subjects were blindfolded. And then we had a waiting control group. And we looked at 24-hour heart rate variability, mental stress heart rate variability, and cold pressor testing. And basically, what we showed is that during exit, during their mental stress, we could really bring out some changes when you compared your traditional acupuncture patients to sham acupuncture. And what you saw was better high frequency, so higher high frequency and higher low frequency to high frequency ratio, and your RMSD and PNN50. So those are all markers of parasympathetic tone. So it seemed like their parasympathetic tone improved with traditional acupuncture compared to sham. So this is very interesting because heart rate variability, when you alter that, it can have implications for arrhythmias and sudden cardiac death, because a lot of patients who have stable heart disease, they are at risk for sudden cardiac death, and traditional risk factors don't explain it. So if you can modulate their autonomic system, it may be a beneficial effect. And so we need to conduct a larger trial looking at this. So acupuncture, is expensive for people because it's not paid for by insurance right now. But it's still, each session is probably about $50 to $75. So it's feasible, for 12 weeks. And if you see differences, and ultimately if it's helping with arrhythmias, then it would be worth it. Our clinical outcomes, the way the trial was designed, it was specifically to look at blood pressure, lipid panel, high-risk CRP, cortisol, and then peripheral endothelial function, and psychosocial variables. And we did not see any effect with acupuncture on those variables. We only saw an effect in the heart rate variability.